We are streaming live, and Ms. Petra, I'm super excited for this conversation. Thank you so much for your time and your wisdom that you're about to impart. And so, as you know, this month we're focusing on addictions overall, especially when it comes to alcoholism or just anything in relation to addictions. And so, can you let the people know who you are and a little bit more about your private practice?
You're most welcome. So my name is Petronellah Thomas-Shanobi, but everybody calls me Petra, so I'm okay with that. I own a private practice called Kesma Flame Lily, LLC. So Kesma, that's my dad's first initials, my mom's last initials. Flame Lily is a Southern African flower. So I just wanted to incorporate the African cultural aspect into our practice. So Flame Lily, I thought, what a better way of actually doing that. So we provide autism services, therapy services, so depression, anxiety, the whole 9 yards, and also arms services. So services for people who have had long-standing mental health issues or difficulties. My background is actually in clinical mental health nursing. So I trained in England, in Manchester. That's where I did my initial nursing degree. Then I went to Australia and I did my master's in therapy there. I also did a stint in trauma, also in Australia, drugs and alcohol. So I felt, now I'm ready for the private practice. Let me start something for me. Like I mentioned earlier on, with the African component in their cultural aspect. And also, one of the things that really motivated me to open the practice was the issue that we treat mental health as a one size, t-shirt that fits everybody. Yet we come from different backgrounds. Just the meaning of mental health alone is so different in different cultures. So I just wanted to actually address that. And that is what led me to open the private practice.
Oh my goodness, I absolutely love it. I love when I do my lives, I get to hear each and everybody's individual story, and your background is so well versed and you're so well traveled. So once again, thank you so much for your time. I'm super excited to have this conversation because oftentimes when we think about mental health or even mental wellness, we often forget about the component of addiction. And so addiction is something that we have to highlight, especially with how drugs have been infesting our communities, have introduced our communities and totally impacting us from a collectivist standpoint, as a family, as a network, as just a group or people in general. So how do you approach helping individuals work through the disease of addiction, especially when it comes to those cultural barriers where it's just we know that it's impacting our community, but we really don't want to talk about it, so to speak?
So I'll try and break it down into little bits and then hopefully get to assessment and everything else. I always start by the foundation of actually teaching people to understand what mental health means in different cultures. And one of the things that has always interested me is throughout the years of, our ancestors being stolen from Africa and being brought here, one of the things that has really stayed within the African community is mental health being a taboo. Mm-hmm. And most people don't understand where that comes from. So I'm going to just lay it out there today. So mental health within the African culture is something that does not affect one person. It's actually a clan. So if I were to have to be diagnosed with depression or schizophrenia, automatically that doesn't affect only me, it affects the whole clan in the sense that we become known as the family with mental illness. Mm-hmm. So when your children want to get married, you will hear the other clan saying, oh, you want to marry in that family? There's mental illness there. So the stigma is really ingrained and it's deep. So to then get people to come to mental health and address things that we see. So for example, we all know that family member who after a few bottles of alcohol or whatever it is that they're drinking, they just start being inappropriate, touching family members, saying anything that they want to. And we end up having a nickname for them. And oh yeah, that's Uncle John, that's who he is. And within the Black culture, it's so interesting in the sense that because we are collective people, we kind of overcompensate for the shortcomings of a family member. So it doesn't really become addressed as, that's an issue where people sit down with somebody and say, listen, you need therapy. The only time people will do that is when they start, stealing or, manipulating people. That's where, in most cases, people end up just saying, you know what, we're just going to leave you to your own devices. So whenever somebody comes to us, sadly to say, it's rare that we get people walking into a practice and saying, hey, I've got drugs or alcohol or addiction of some sort, difficulties. Usually it's because they are referred by a social worker because they've come into contact with social services or with the prison system. So a probation officer refers them. And even when you're doing the assessment, you can tell people are very guarded because they don't want to accept the label. Just the label alone is really, stigmatizing. Never mind processing what it means. And because of that, the education of actually understanding what addiction really is or mental health, because addiction falls under the umbrella of mental health, right? It's just too much for people in general to process. So what they end up doing is they will use every excuse under the sun not to either disclose, discuss, or even cooperate during an assessment. So it doesn't matter who you are. When you come to me, I always coach, teach all the clinicians, students that come to me to provide the foundation of information. Knowledge is power. If you want somebody to engage in therapy, you have to have that time to actually educate them. That's always the foundation. Excuse me. So the first place to always begin is, I don't talk about mental health per se. I always look at who they are, where they're coming from. So if I'm looking at somebody who is coming from Africa, from Congo, from Liberia, from Rwanda, we know there have been genocides that have happened there. That is the starting point. Mm-hmm. So you're addressing trauma, and you educate them about trauma, and you educate about, symptoms that chances are when they were filling the intake paperwork, they would have written. So you've got a fair idea of really what is going on there. Secondly, if they are African American, we know generational trauma. So we start by addressing generational trauma. And because addiction doesn't happen in a vacuum, mental health doesn't happen in a vacuum. There's no illness that doesn't have a genesis where it starts from. So when you, by providing education, what you're doing, you're giving somebody an opportunity to normalize the diagnosis and for them to understand that they are not unique. The next stage is demonstrating why they need to engage with you as a clinician. Most people, unfortunately, don't understand, excuse me, the link between mental health and your pocket. So providing education in regards to, if you look at the statistics of Caucasians who come in and seek supports, and you say, yeah, we've got depression, or we're looking at OCD, we're looking at addiction, gambling. It could be, I don't know, from gambling to some people sex, some people from relation to relationship, just the highs of starting a new relationship and then ending. So when it comes to the Caucasians, they understand the need to comply with medication or to engage with a clinician because there is education there already, right? So whenever we engage any person from the minority communities, I always try and educate them in regards to the need for you to actually engage with a clinician is to stabilize your mood. And to stabilize your mood, I'm going to educate you also what it means to have any mental health diagnosis. It's a chemical imbalance. And because it's a chemical imbalance, it has nothing to do with you per se as a person. Because it's very easy for somebody to get into your head and start thinking, well, by accepting and seeing a shrink or somebody who has anything to do with mental health, that means there's something wrong with me. Well, if there's something wrong with you, then that means from a mental health point of view, 1 in 3, people have a diagnosis of depression. But think about it from this point of view. How many people underreport mental health needs? So let's assume it's 2 in 3. That means between me, you, and somebody else in wherever you are, 2 of us have depression. The difference is we choose to do something about it. That's why we don't talk about it, right? So when you break it down and you normalize it, you are enabling a person to engage with you because you've made it interesting. You have taken away that factor of there's something wrong with me, to a diagnosis that is more or less like diabetes. So I'm going to give you another example that I always give all my clients, from drugs and alcohol, addiction to drugs, addiction to sex, addiction to gambling. I always say to them, let's assume you come to me. I'm a mature woman, and as we know, African-American women, once you hit 50, 55, diabetes seems to kind of stalk you, right? So let's assume you come to see me and I say, hey, I want to have a chat with you, but you know what? I'm going rushing to see my doctor. How about accompanying me and we can continue chatting? Okay, so you come along with me. And as you're sitting there, you hear the doctor saying to me, oh, we have your results. So it looks like you're diabetic now. The few questions I would ask is, what type of diabetes? What does that mean for me? What kind of diet? Do I have to lose weight? And what's the prognosis? What are we looking at? So within 10 seconds, I've managed to ask like 10 questions. But when it comes to mental health, people will never ask you 10 questions in 10 seconds. Why? Yet both of them impact you more or less the same.
Right. Definitely. That mind-body connection. I really appreciate the fact that you identified the cultural competency piece of it all. And it's very important for people outside of our community to note that as well, because like you mentioned, there's like all this generational trauma, or maybe even like the history of genocide or whatever the case may be. Another thing that I also noticed as well is you identifying the benefits rather than always leaning more on the negatives, right? And so finding that connection piece and showcasing like this is how therapy or therapeutic services, or maybe even holistic wellness services can do for you, and how that can improve you in other areas of your life, whether it be financially, occupationally, environmentally, socially. When we start looking at, okay, if you do A plus B, this is what we're aiming to get through when it comes to C. And so walking through that process and showing people, I currently work in the addiction space as well, substance abuse specifically. And I definitely agree. Automatically, when people are coming in for their assessment, they are either in this place of like desperation and they're willing to talk about it, they're willing to provide that information. But if they're mandated, or if they find themselves being forced to go by friends and family, it's more of like this downplay and this minimization of the diagnoses or those presenting concerns. I think also too, because of the fact that we are such a strong people, just the idea of being vulnerable enough to ask for help or to showcase any form of weakness, that becomes a detriment to ourselves. The services are there, the resources are there, but sometimes it's hard to put one foot in front of the other because of that stigma within itself.
Absolutely, it is. Because everything leads to what if relatives find out? What if my partner finds out? Then, so let me just backtrack a bit. When you were talking just now, you reminded me of slight area that I didn't address, but that is so significant in diagnosis of mental health. So my mother is Zulu. And in Zulu, what that means when you are diagnosed with mental health, automatically you're told, when if families gather, you will be told, hey, how about you go and head the boys, the kettle, go and spend time with the boys. You're dismissed. It's almost like you're condemned to, you have nothing to contribute to the community or in the goings on of the family structure. So why should I then engage? Why should I even accept that, there's something going on? The sad part about it all is this. People think gambling happens to middle-aged men or young boys who spend so much time on the computers. Gambling, as you know, begins even at 8 years old, because all you need is your phone at the moment.
Right.
So by actually not really stepping forward and people addressing gambling and mental health, and also, breaking down to triggers, because I call triggers the golden key. So unless you understand what addiction is all about, then you just think it's somebody who just likes spending money because they like spending money. Yet it's at a deeper level. Or it's somebody who goes out and seeks sex from anywhere and everywhere. Or it's somebody who will do anything for drugs, really, because they just can't help themselves. Think about it from this point of view. How many times have you heard people say to you, oh, you work in drugs and alcohol? Yeah, well, I don't have much pity for those people. And instantly, to them, they're dismissing this community. But to people like us, we are like, okay, you just demonstrated that you could benefit with just 30 minutes of education in regards to how strong addictions are.
Right.
Addictions, so I'm going to use a simple example, or hoping, we'll be able to take it apart and, educate people much more. So let's assume with COVID, I'm going to use an example in regards to COVID. So with COVID, most people have lost jobs, right? You're feeling bad. Just being given a pink slip says so much to you, It's kind of like if you're a dad, you're like, what am I going to do? Bills have to be paid. So you're feeling bad already. You're struggling maybe even to get out of bed. Chances are maybe there were a few symptoms, depression symptoms that were just niggling in the background. And loss of that job, and to a man. So I'm going to stick to what I really know best, which is Black men or African men, because we bring them up to be the providers, right? And if it is African, because from a young age, they are groomed to be the head of the family, to be the provider. So take away that ability to be a provider, you have taken away their identity. So when you do take away that identity, what you have done is you are left with somebody who is just trying to understand, where do I begin? Where do I start from? Bills are piling up.
Yeah.
So they have $20. They've been called for this interview. 100 other people have applied for the same position. They go there, they are told, sorry, we've hired the other person. They've got better qualifications. This person has got $20. That rejection, it's almost like a key that is unlocked that cycle of depression. So automatically you go, you know what, I've got this $20. The lights are about to be switched off. Maybe if I go into the machines and put it in the machines, maybe, you know, I'm going to win maybe $200. Last time I kind of won something, so maybe this might be just that lucky day, right? So he goes into this gambling place, plays the $20, and he loses it. So there was rejection initially, and now we are going to loss. Now that $20 was the last $20 in his pocket, and at home there's no milk, kids are waiting. The automatic thought then is, I'm a loser. I'm a loser. I would never be good at anything. Other people kept their jobs. I was, you know, laid off because I'm useless. I'm nobody. Why would I even think that I would get married and be able to, you know, keep a family? So when the automatic thought is so negative, you're not going to feel all warm and fuzzy. Usually when we are really screening people with either addiction or anxiety, it's still the same assessment. We're looking at your feelings, you know, the sweating of the brow, sweaty palms, palpitations, stomach falling. Some people feel dizzy. Some people feel like throwing up. Some people, you know, their stomach literally drop and they need to rush to the bathroom. And once you're in that state where you're feeling so yucky, a behavior has to happen to release all that yuckiness. Maybe you have got a blunt, that's cannabis, right? You smoke your cannabis. It's not the most healthiest and best way of coping. Some people really feel like suicidal because they are like, I'm helpless. Some people are like, you know what? I need to go back to the machines. I'm going to sell this watch. Yes, it's my grandfather's, but you know, hard times and all that. You're going to sell that watch. You go back to the machine. You lose again. So it becomes a vicious cycle of loss. And when you keep losing and you keep reinforcing that sense of uselessness, that's where you end up with somebody wanting to take their own life.
Yeah,
that's how bad addiction. And that was just in a short, you know, kind of way of explaining it. But there's much more that goes on in there, and I'm willing to explain that further.
Yeah, definitely. So even showing the whole cause and effect situation, and I'm really glad that you touched on the triggers part. And for anybody who's watching this, I do want to briefly explain the difference between like triggers and warning signs. So triggers are that thing that's going to start the snowball effect, like what circumstances or what situation leads to the negative feelings and also the behavior at hand. And then kind of like what Petra was talking about in terms of like heart palpitations, sweaty eyebrows, having increased racing thoughts or whatever the case may be, those are warning signs. And that's why it's very important to increase self-awareness or to be able to note those things during intake or even throughout your wellness journey. Because if you notice these patterns of behaviors, some of these manifestations are going to show up consistently across the board. And so that's why it's very important to have the coping skills to slow down and be able to tap in, probably do like a body scan or whatever. There was something else that I wanted to backtrack on as well. You talked about coping. We understand that you can cope with negative coping skills and you can cope with healthy coping mechanisms. So as we see in addiction, whether it's smoking or whether it's, like you mentioned, going back to the slots, leaning more into that risk-taking behavior, or feeling so bad about yourself that you feel as though, like, what's the point? That helplessness and hopelessness further perpetuates the negative or the maladaptive behavior patterns. And so finding ways to just stop for a moment and seek help and seek treatment to help circumvent the tendency to lean back into those negative behavioral patterns. That is so important. So thank you for highlighting that.
Absolutely. So every behavior, so there's negative behavior, positive behavior. You can't stop a negative behavior and not replace it with a positive. It doesn't work that way. It's not an easy thing to do. So I always lean into my African heritage again when I'm doing therapy. So I tell stories. The reason why I tell stories is between my heavy, broad Southern African accent and what I'm telling you, what clients have told me is like they hear this accent and the story, it's like sitting here and going, no, that's not what we talked about. No. So I'm going to tell you a story in regards to change of behavior, because when we are talking about it like this, it's like we're saying, well, it's easy. You can do it. We talked about it. No, it's not. So here's the example I always give everybody. So years yonder, I used to work in South Australia, in Adelaide. And for my lunch, I always used to go and eat on the pier. And I would watch huge container ships that would come from China to deliver things in South Australia and then go back to sea. One thing that interested me one afternoon was I noticed whilst I was still in the office, this ship slowly going into sea. And then by lunchtime, it was turning to go the other direction. And I went, hang on, that thing is humongous. And it takes time to actually turn around and go back where it wants to go. It's exactly like the therapy that we do with people. It's hard work. It's tough because you are changing learned behavior. Learned for 25 years, 30 years, you have been behaving in a certain way. And then here you are, you're coming to see people like me, and we are saying, guess what? Between the thought, remember we talked about the golden key is the trigger, something bad happening that leads to you thinking negatively, and the behavior that leads to almost, in therapy, we say it completes the circle, right? So between the behavior, we then sit down with you and we think, hang on, so are we going to work on the cognitive? That's the thought. Try and replace negative thoughts with positive ones. And the behavior, negative behavior with positive. So that we have two ways of helping you to address whatever addiction or mental health issues you come with. So I'm going to tackle the behavior first because I love that. So the behavior, if you find yourself, so let's assume, to get release, you scream. They're screamers, right? We all have seen people who are like, yeah, and the kids are just cowering, everybody's feeling uncomfortable. So when you come to us, we, with compassion, because this doesn't happen if you don't have a good dollop of compassion. And when we are talking of compassion, we're talking of self-compassion. That's where it goes back to the foundation I was talking about earlier. The reason we give you foundation and we remove that sense of there's something wrong with me, it's more for you to understand it's a diagnosis, it's a disease, it's an illness, right? Yeah. So the reason we do that is when we are changing the behavior and we discuss what you're comfortable with, I have to repeat that, what you are comfortable with, not what we are comfortable with.
Yes.
We might even think, oh, you're capable of doing ABCD. But if you come to us and we say, we use these days the person-centered model, right? what you as an individual, to empower you so that you feel you have this sense of autonomy, a say in your well-being. Therefore, what that does is there's buy-in on your end. I need to change because I want to be that better person. I want to be there for my children. The money I'm spending, my children are going to go to Yale, and I'm going to save every penny to make sure that they go to Yale rather than going down my gut is alcohol, right? So we look at behavior and you're like, okay, Miss Petra, I think I can manage to reduce, let's look at alcohol addiction. So I've been drinking 10 beers per day, you know. So realistically speaking, I think I can reduce first week 1 beer less per day for a week. We didn't say you totally stop. That will never happen because what we are looking at is this has been happening for a long time. So you start by gradually reducing. The reason we do that is when we are doing the treatment plan, the agreement of this is how we are going to go about it. Your goal has to be realistic for it to be effective, to change a behavior. It has to be achievable and it has to be measurable. 3 things, right? So we're looking at realistically looking at 1 beer. It might be even half a beer. So we're looking at 9.5. But it has to be up to you to be able to cope with that urge to drink, because it's going to be stronger than you have ever known. You know, when you're trying to stop to smoke, ask any smoker, they'll tell you it's difficult to even just, but it's up to you to come in and then say, I'm willing to do the hard work. That is why when we are talking about therapy, we say it's hard work. And people are like, how hard is it? It's sitting and talking, It's tough.
Right. They definitely underestimate it. And I guess ultimately we always have to remind clients that it's a process. And to have, like you mentioned, that self-compassion, taking it one day at a time. In the recovery community, we say day by day, or just, living in the moment, or, learning how to turn it over to your higher power, just finding those things that'll help you remain anchored. Just like I really appreciated how you touched on looking at your disease of addiction and finding those intrinsic and extrinsic motivators. So whether you're struggling with gambling, okay, what can this money be used for? And how can I just put that off to the side? For me, I use this thing, I created like this document for my clients where they literally had to look at how much their addiction cost them. So how much did it cost for you to purchase the drug of choice? How much was it for you to put gas in your tank, or for you to go get a bus pass to go get your drug of choice? How much fees, restitution, and fines did you have to pay in order for you to remain in compliance due to probation? Like, how much did your addiction cost you? And sometimes a lot of my clients, they have like hundreds of thousands of dollars. And then I go back and I'm like, well, what could you have done with that money? And they're like, well, I could have had multiple houses, or I could have sent my child off to college, or I could have invested that, or, things of that nature. And so making it very plain and practical, that is very important. Like you mentioned, it sounds easy, but when you start getting to the nitty gritty of actually doing the work, they are literally just sitting there looking like, wow, like it's crazy.
Absolutely. And, when we are doing that foundation stage, I always say to all of them, there are days you're going to like me, like Miss Petra, do you want a box of chocolate? And the days when you're like, Miss Petra, I don't think we can do this. Why am I even seeing you? And then there are days when you come, I've had clients who come in and say to me, especially the ones with drugs and alcohol, because I have to work with other teams. for medication management because I don't prescribe. So when they start complying with medications, remember the stigma also comes in different ways as well. So it's just addressing mental health, then it's addressing the drugs, the medication, and then the compliance and, providing that psychoeducation about why comply with the medication. So I had an interesting interaction with somebody a while back, and they came back to me and said, I don't like you. I said, whoa, I didn't expect that. What have I done? And this person said, because it took you so long to get me to start taking medication. And I said, if you remember, I had to use backdoor therapy to get you to start taking medication. She says, yeah, I know. I need to blame somebody, right? And by the way, you're invited to my engagement. So what had happened is when I started, unpacking it with the client, it turned out the exact words were, I was living in black and white world. And when I started complying with medication, I started seeing color. And then I started incorporating the skills that you had taught me over the 1 year. And I'm so surprised by what I missed out. And, how cultural issues, because they came from a cultural background where medication is a no-brainer. It just doesn't happen. Mental health, you don't even discuss it. You don't go there. So what I'm saying is to get appropriate services and to get to a place where you are fully functional, to a place where you regain that relationship that had just, gone to pot. The children who have grown up minus you, the loss of property, the loss of self-esteem, self-dignity. To get to that place where you start feeling I'm in control again, it's a journey.
Yes.
It's a journey, and it's a journey that can only happen when you are ready. It's a journey that is encompassed in what we call Ubuntu, that sense of well-being, that sense of I am because of you. So let me say that again. Umuntu ngemuntu ngabantu. That's the Zulu of saying I am now what I am because of the people that surround you. That's why I am the person that I am. Therapists, nurses, doctors, they are your treatment team. They're not people that you just see here because I've got an issue. No. They are your treatment team, and you will only get well because it's a long process, right? When you are committed to it, when you are committed to working and telling people, you have to, the healing process. Did I call it healing? Therapy is healing. Addiction, when you are working through that, there is a lot of healing that needs to happen. Addiction leads to burning of bridges. It's like a wildfire in Australia that just burns everything in its way. You are not going to engage in therapy and effectively gain what you want to gain if you don't start by self-compassion, forgiving yourself and loved ones too. I'm going to tell you something that I learned in my travels. I told you I'm a storyteller. So I worked in Ireland. That was after working in England. And I love the Irish for one reason and one reason alone. And they are the only community that I've lived with, worked with, that treats a loved one with love, with compassion, with dignity. And because they do that, the healing process is much faster. It's effective. And at the end of the day, what that allows the person who is going through the healing process is an opportunity to actually be fully engaged by asking and telling people what they want. Addiction is I call it, no, I'm going to stay away from that word. Addiction is a difficult diagnosis to kind of address because the triggers are everywhere. It's like walking in a minefield. They're everywhere. So that is why in clinical mental health, we say your family, your friends, your boyfriend, your girlfriend, they are your core therapists. That's why I say family or having that support system is important. They are our core therapists because you come and see me for 1 hour. They live with you. But they're not going to help you if you don't feel comfortable and you haven't done the healing of saying it's a diagnosis, it's an illness. So I'm going to discuss it with everybody. This is what's going on. And I need you to support me to get through this. Because life is, it's life, right? Life, you lose, you win. You get that phone call, you get that rejection, you're triggered all the way. It doesn't take much. Going back to addiction of alcohol, I think it's easier to use alcohol because it affects different people, right? So let's look at a mom who stays home and who ends up addicted to alcohol. When you're doing intake, how many times have you heard them say, well, the kids were crying and I felt alone. My husband is working long hours. And I thought, you know what, just a glass will do it for me. And I did a bit of ironing, I cleaned. And before I knew it, I was hiding alcohol in cupboards, in cars. And, I was hiding money just to go and buy alcohol. So addiction, there is no person who says, well, it's not going to happen to me. I don't think so. It can happen to any person from all walks of life. So the message that I really want to impart today is, as people of color, let's learn to destigmatize mental health. Let's learn to be very supportive. And if we don't understand, I love one thing. I love Google. What does that mean? It's not for diagnosing somebody. Please don't go do that to family members. Don't do that.
Please don't.
It just makes them go deeper. Trying to understand where they are coming from before you give up on them. Trying to not name call people. We hear these slang words for calling people who use drugs or alcohol. And yes, addiction leads you to stealing jewelry, to lying, unfortunately, especially to single mothers. I was a single mom for 10 years, so I know what I'm talking about. To somebody saying, I'm coming to pick up the kids, and they don't turn up, and you've got a shift lined up. And you are left pulling your hair out. It's so easy to then, literally that frustration, and then the children can hear. Do you see the ripple effect of addiction?
Yes. It's
the children who are affected. It's the children then who have to hear, oh yeah, your daddy is, or your mama is, she left you. So now we have another generation that we are damaging. Never mind the other generation. We talked about generational trauma earlier on. I just want, and this is with all due respect. And so if I'm out of step, please correct me. I'm one of those learners, so I'm good. So I'm just going to use something that is very, it's heavy, so I say it with all dignity. So, whenever we are addressing, no, let me start from this point. Last year, I was a fellow at University of Minnesota. And one of the lecturers that came in is a professor. Unfortunately, I've forgotten his name, and I'll look it up because I want to give him credit for that. And he came to teach us about working with the African-American community because, as immigrants, we come in and we think we know it all, and then you are humbled by, no, you not so fast, young lady, not so fast. So In explaining trauma and generational trauma and how it kind of, it's almost the root cause of most of the issues that we are seeing social-wise. And he put it in this way. Whenever we're talking about slavery, it's like we're talking about something that happened 500 years ago. The effects of trauma that we see associated with addiction a lot of times is not only 50 years ago. My grandmother would have been born in slavery because I'm 53. Mm-hmm. So born in slavery, she was not allowed to bond, to hug, to sell, to be soothed, to be told it's okay, to be hugged and, be reassured. So when you grow up with a mother or a grandmother who had to go endure such trauma makes you handle things in a different way and to respond to things in a different way. And with that, because you have to adjust in that way, and you're coming from a home like that, when you go into the world, you have to cope with the same way, right? Because you saw it happening, you saw the triggers, you saw, and so on. And so when people come to us, it's so easy to dismiss people and just say, listen, get a hold of yourself, stop hitting the bottle, stop doing this, and maybe your life would be better. It's so dismissive. To take that opportunity and honor people when they come to us and say, you know what, as a people, we've walked through calls. As a people, our roots are embedded in the most toxic water. As such, our roots have been drinking from this water, and our leaves and our fruits, they are not as productive as we would have wanted to because of the river that we have been drinking from. Mm-hmm. So as such, let's address where this is coming from. Let's destigmatize it by acknowledging where most of this is coming from and taking away the blame that we kind of, I call it like butter we kind of thinly put on bread, and we kind of like, there's your sandwich, you eat it. That's wrong.
Yes, I definitely agree. I really appreciate the fact that you touched on the way to actually even approach all of this in general, especially when it comes to destigmatizing mental health within our communities, because sometimes I think in the substance abuse community, people just automatically think that it's like the drug of choice that is the source of the problem. But oftentimes what I'm always having to explain to family members is just like, what came first, the chicken or the egg, the trauma or the circumstances, or maybe you started using drugs at an early age and you just kind of had the symptoms started becoming more apparent with drug use. Another thing too, like you mentioned, just the integration of everything. So not only having that family of choice through like your clinical team and your clinical services, but also educating the family as well. Like we already know, like we have Alcoholics Anonymous, like the family portion of it all. We also have like those psychoeducational courses for individuals or for wives or maybe even husbands or spouses and partners that deal with gambling and whatnot. So being willing to educate yourself as a loving family member or a loving partner, and then also applying that information at home as well. Because like you mentioned, we only spend time with them 1 hour a week. But if we're taking that information and applying it to an everyday course of action so that it becomes a lifestyle, you're holding that person accountable, and you're also making sure you're not operating in a place of enabling as well. That is so key because to put all of the responsibility on that individual when they're not in the right frame of mind, we have to find ways to like put the boundaries in place, but also hold the client accountable for all
accountable.
Mm-hmm. Yeah,
absolutely. And they will, to kind of I don't know, put a bow on it. Yeah. We're talking of relapse, right? So family members have done all the hard work of supporting somebody, driving them to groups, taking them to assessments, and people relapse. Remember what I said? It's like a minefield. People tend um, to be triggered by different things. So here's what I normally do for people as we go along. We just have like 2-3 sessions where I encourage them. Hey, what are your symptoms? What are your specific symptoms? I didn't say go on SAMHSA, NAMI, all these other websites and you look at, oh, these are the symptoms. Yeah, I think my cousin fits all those. No.
Mm-hmm.
Empowerment is the ability to say, I experience this. When? When I'm shouted at, when I'm this, and when I'm with who, this bed friend, the moment I'm with this person or this girlfriend, this is the one that I see often, trauma, codependency, enmeshed relationships, where all you need to do is just to spend 1 hour with this person, they trigger you, you end up, you high as a kite.
Right.
So once you write all those symptoms, the triggers specific to you, what that does, it gives you an opportunity to actually say, this is me. And I'm good with that too. Because every person has got their own struggles. Some of us is just that, we know how to hide them very well and to package them and move on. So we could present well put together. But every person has got their own struggles. And the reason why I'm saying that is we are all normal, right? Some struggles are just slightly harder and need more work. Because if I say, well, you are like, then I'm all hotty-totty and you're not going to even listen to anything that I'm going to say.
Right.
So learn your triggers, learn your symptoms, and then knowing those two, you have empowered yourself, but that empowers you to sit down with a doctor, with a prescriber, with a psychologist, psychiatrist, therapist, and say, hang on, based on what I have written, I need medication that is non-addictive, less side effects, and I'm willing to come and talk to you. If this medication is not working for me, I'm willing to come and self-advocate and tell you and try something until we find something that is working for me.
Yes.
When you do that, that is the first step of taking control, not only of your life. Here's why I always stress this particular stage. You do not change anybody else on this planet. You change you.
Right.
You hold yourself accountable. If you ever think, I'm marrying somebody because I can change them, come see me or come see any of the therapists who are here. We'll help you.
Right.
You change only you. So when you are able to advocate, and not only advocate, but educate those around you, because now you know what is going on. If you are bipolar, if you are schizophrenic, what that does is it enables those who are near you, because you're not able to scan yourself and to rate yourself, but they're able to then say, hey, we need to pay a visit to Miss Petra. Things are bad. And you say, well, you can stay married, go to work, you earn more money, you can actually concentrate, you show up on time, you contribute to the community that you live in, you start enjoying games with your children, lead that life that you wanted. But I repeat, it's hard work.
Love it. Oh my goodness. Miss Petra, I greatly appreciate all the wisdom and insight that you were able to provide the Legacy Speaks community. Can you please let the people know where they can find you and how they can stay connected with all that you're doing?
So we have a website. It's flamelilytherapies.com. Our phone number is 763-412-1996. I'll repeat that, 763-412-1996. And we're on social media, but we're working on it. Website is much better. There's also where you can send us a message. And, we welcome anybody and everybody. So feel free to contact us for anything. As long as we can help, we're here for you.
Absolutely. Thank you so much for your time. I greatly appreciate it.
Thank you for inviting me. Thank you for your great work. And thank you so much for stepping into the gap and, feeling, doing the work that should have started long back, but it's never too late. So thank you so much. God bless you and do not end.
Thank you.